I mean, one of the things is kind of like babies die in hospitals too, is a way of saying, I don't see anything wrong with babies dying out of hospital. I mean, it's like, no, you really, people do. People, it's one of those things. I worked at a pediatric hospital, and it's just, I just didn't know how many babies died. You don't see them. They don't live very long. You don't get to know them. They are only the families who knew them really understand the loss. You're just kind of like, oh, I didn't know you had a miscarriage, or I didn't know you had a stillbirth, or no, I didn't know you lost a child at a young age. But when you work at a hospital, you just are kind of stunned by how many losses there are and how many grieving families you don't know about. So it's one of those things where it's like, yeah, every loss matters. Every family should be enabled to talk about the child they had and the loss they suffered. And the home birth community, or the out of hospital birth community, is kind of like, well, babies die in hospitals too. We don't want to talk about this thing. We want you to be uncomfortable. We want you to be on the defensive. We do not want you to ask us about these babies who died. And yeah, I can see why. It kind of sucks to find out that the people that you trust and admired and respected and recommended to other people were really delivering such poor care that they were having preventable deaths.
You know, I noticed last week somebody who was going after the comments that we had made and gone after it was actually, the video was posted and someone started commenting on that and saying, how dare you? You need to put not a trigger warning, but you need to make it very clear that you are not talking about this kind of midwife. You're talking about this kind of midwife. And they were angry because they had a good experience with their however many, children they had with a nurse midwife. But you have to be able to look outside yourself too. If you really do want to be educated or informed, you need to look beyond what your own situation was and your own experience, and be willing to change your thoughts. That's what someone does if they want to be educated. You have to be willing to change, having your experience be the only one that matters.
And I've actually heard of a lot of nurse midwives that I know have experienced loss from somebody, or they've seen horrible things happen with out of hospital births, or they've seen things that have changed the way that they view care. One thing is, it's kind of weird to even bring up, but because I was overdue, but one thing that I heard about people that have been around for a long time doing care, being a midwife or whatever, is so they had to experience or see something that went basically really dangerous with overdue, to be like, whoa, overdue is actually dangerous. And I don't want to do that. And I don't want to take any chances. So then they started like taking more precautions of like, oh, we got to induce by a certain time, or we got to get baby out at a certain time. So they learned from it. But a lot of midwives aren't learning from that. They're not seeing that is a problem. And we see a lot with CPMs and lay midwives, but there is some nurse midwives that are not seeing that as a problem. And I know from even chatting with other nurse midwives, the good ones will tell you that they get in kind of almost like a little argument with the other nurse midwives where they're like, no, even sometimes past 40 weeks is dangerous, but past 41 is dangerous. And other ones will be like, no, it's fine, but it is dangerous. And we do have proof of it. We have studies on it. We know a lot about that, a lot of details of evidence that says it is dangerous. And now they're doing a new study where they're showing like, maybe we should be having babies come out and be, induced or C-section even earlier than 40 weeks, because once we're even hitting like 40, sometimes stuff is happening. So it's like, who's following the evidence, who's following the science? Some are, and some are seeing it, and some are experiencing loss or pain or grief and then being like, we're not doing that anymore. Or we're never going to do whatever. And I have had a few people that seen what happened with Gavin and then was like, oh, I can't be part of the big national midwife, whatever thing, because they support CPMs and look at what CPMs are doing. And it's not just because I got a bad CPM, but she went on Facebook and talked to a bunch of bad CPMs. Like a bunch of them started popping up saying the same advice. So it was kind of like there is good nurse midwives out there, but there's also these ones that are, I don't know, they're kind of behind in the times. And that's why I was asking the outdated question was, are they outdated? If they're not following the evidence, following the facts, following, hey, this is risky, I don't want to do that, and changing. There's another thing of people making mistakes because we're human, but then there's another thing of people making the same mistake over and over because they never learned from it. These are, you know what I mean? Doctors learn, nurses learn, and nurse midwives learn too. But there is some that are not learning. And I'm sorry, we have to call them out. We have to call them out for what they are. I would call out a doctor and I would call out a nurse anytime if I hear about stuff going on. And I do know people that have had bad experiences, and guess what? They reported them, and guess what? Things have gone on. But I can't just, I have to blanket midwives, unfortunately, because we allow anybody have the title. The title's out there. If only nurse midwives were the only ones with the title of midwife, then that would be different. But because you can have a lay midwife, you can have a CPM, there's licensed midwives, there's all these different titles. I'm not going to do every single video where we explain every single title of midwives and what their education is and what their training is. And by the way, it's different per states. We're not going to do that, because that's going to take away too much time of just be aware that there's people out there. If you go to a hospital and you have a nurse midwife and she's doing things that you feel uncomfortable with, or they don't feel right, turn her in, just like with a doctor, just like with a nurse, period. Turn them in, get away from them, fire them, basically. Like, whatever you got to do, just be safe. And that is my big thing, is I just want people to be safe. And I want people to be aware and to make better choices and know what's going on, in the world with care, because there's a lot of things that we just don't realize. We have more choices available than we really think we have. We can do a lot more things. You can be in birth and somebody's treating you like crap and say, get out of here, I don't want you here anymore. Like you can tell the hospital, please remove that one from my room, they're not treating me good. We have these abilities to do these things because we do have a system that's set up that you can hire, fire, you can do things where we have this ability. And it's amazing. It's amazing that we can do that. But unfortunately, we do have a whole nother side where there is midwives that are not regulated, midwives that we can't do all these things with. There's a whole nother side and a whole nother world. And I know a lot of people want me to jump in with the hospital care and we improve hospital care. And guess what? I would love to improve hospital care and work with the doctors, work with the staff, and work with the system and make it better. I would love to. And I'm totally on board. But I also have to think of, from my personal experience, I have to work on changing things that has to do with midwives. We have to make it better because we have to make it safer for out of hospital.
Well,
and that's kind of the thing of like, you know what I mean? Like people probably think I'm kind of whatever, but we have to improve it all,
People can help improve hospital care by speaking up. And if someone does something egregious, you can report them. There are ways to do it within the hospital system. And if you think the action they took is especially egregious, you can report them to their governing body, whether it's a doctor or a nurse or a midwife. They can all be reported. The thing about the out of hospital anybody's is the fact that if you do not have hospital privileges, that is one method of reporting that is not available to you at all. So, and the thing is, hospitals are money. People who work in hospitals, they're paid well to do that. So if you can actually either A, get them kicked out, which hopefully is not the point unless they really are an imminent danger to their patients, or you can cause the hospital to crack down on them, and that can cause, and if it's a transgression is great enough, they can either be fired for it or they can lose their privileges at that hospital. So yeah, you can improve hospital care. I mean, everyone would like to say, okay, but I shouldn't have to do those things to get the care that I deserve, that I am worthy of. But, you know, if you don't say anything, that person is just going to go on to do what they did to you to somebody else. I mean, and if you can't save yourself, are you willing to make a sacrifice to save somebody else?
There are people in the hospital who are there just to take down and listen to patients' experiences and their families. They're there to make your stay I guess, as pleasant as it can be. Like, there are people actually hired by the hospital and a whole department that's dedicated to that. So, there's a way to report it. I understand if someone works outside of the system, it's harder to do that. So you have to consider that too. If you choose someone who's out of the system, you may not be able to report that or ever get heard and be listened to.
And it's like, I mean, I love the people who come onto social media and complain, and then we ask them, there's a way you could report it. Would you like, I can tell you, I can look it up for you. If you give me the name of the hospital, I can give you address, zip code, everything. And there are people who are like, I don't want to do that. I'm like, well, then you can talk to us all day long, but nothing will ever change. Talking to social media. Yeah. It's not how the world works. The world occasionally takes note of something that goes viral, but one internet rando talking to another one is not how the world changes.
Yeah, it doesn't do anything for laws. It doesn't do anything to change procedure about how to handle it. It's just you talking, and it is one thing to be heard, but it's another to actually be listened to and have the problem taken care of.
Reporting is a whole nother thing, because I have had a lot of people that I've met over the years that are like, oh, well, I've had this, the doctor, I've had whatever. And every single time I've asked them the same thing. Did you report it? Did you report this? And very few have actually reported it. I do know some people that have experienced the most horrible you can experience, and things did go further. They did get a lawyer. There was a lot of things that happened, but a lot of people don't report it. And I'm like, well, why wouldn't you report if this doctor's so bad, like you're saying? Why wouldn't you want to report them so other people can get away from that doctor? You have to turn them in so the hospital can look into them, and maybe they shouldn't be practicing if they're that bad, or, whatever. I'm like, but nothing happens if you don't say anything and you don't do anything. We have to do stuff. And that was the worst thing. When we lost Gavin and we were calling all over and nobody could do anything. We couldn't do anything. And I was like, all these systems and all this laws and all this stuff, and there's nothing we can do, absolutely nothing. And it was just, it's a weird, kind of in a, powerless. You feel so powerless to the justice system has failed you, because there is no justice. There's no system. There's no nothing. And it was pretty devastating. It was pretty horrible. And I mean, we called everybody. Oh my gosh, we called everybody that we could possibly Google and look up. We called all the different places of the state. There's the medical board, there's the nursing board, there's the midwife. There's so many boards. We called so many different places and called so many. We talked to the police, by the way. We talked to the police, who put us in touch with a detective. I mean, all these different things to go over the state laws. I mean, we did everything. And there was just nothing we could do. And a lot of people were so upset by this that they were like, I have nothing to offer you. I can't even send you to somebody. I can't direct you to someone else, refer you, because there's just nowhere to go to. And even mine was a criminal that jumped borders, and still there was nothing we could do. She was already in trouble. So, I mean, that just shows how lax the laws are when it comes to out of hospital. But another thing that people aren't aware of is that, how do you keep track of them? They're not like a doctor in a system or a nurse in the system where they have like a number behind them and all that stuff. They literally change their names and move around. Like they're like anybody. It's kind of like, sounds weird, but it's kind of like a traveling circus. You don't really know who's in that circus. Like, you know what I mean? They can just go around and change acts. And I mean, I know that sounds like really weird, but they can put on another mask or put on whatever, and they just change and they can just keep changing and nobody would know the difference because we can't talk about it. Like it's not anywhere.
In the hospital, right away, you can ask to speak to the patient advocate. And I believe most hospitals have one on 24/7. And if it's a problem with a nurse, you can ask to speak to the nurse manager on that shift. And you can do that right away. You don't need a lawyer. If you're in a hospital and you're having problems with the hospital, you don't need a lawyer. And if you're with a practice, you can always ask, you could always send a message to the head of the practice. Somebody owns that practice or runs that practice if it's a corporate owner, and you can send a message directly to them. If you're having a problem with someone who works there, we are not powerless. We are only powerless if we refuse to take our personal autonomy and our personal power and do something with it.
How can anybody be aware of a problem if nobody's talking about it? Nobody's sharing about it.
It's not enough for us anymore to just have the title well woman care. There are specialists who deal with this. We're not, it's not enough anymore to know a little bit about the process of pregnancy and birth. You better know all the variables.
Mm-hmm.
And I think this is a discussion that should be ongoing. I think midwives should have a right to, step up and tell the world who they are and what they do, and not in some cookie cutter, cliched puff piece. I mean, it's more than some cute ideal. It's more than, oh, look, we have midwives now. This is amazing. It's like, well, midwives are amazing, but they're healthcare providers just like anybody else. And we should say, so what kind of healthcare provider are you? What do we expect from you? What does this mean for me? It's one of those things that I think that people, for some reason, feel the need to package in a certain way to create a certain narrative for, and that's not appropriate. It's much more in-depth. It's much more complex. It's much more real than some cut and paste narrative.
Mm-hmm. Exactly. And I do think this is an ongoing topic because, again, everything's changing. Things change and we should be moving forward. And I do think, and I'd like to hear more from what people think about this. I mean, this is like, we're a discussion group. We discuss different things and topics and stuff going on. I would like to hear more of what people have to say because, again, as much as people were kind of mad about me not saying what type of midwives, I did get a lot of people that probably would have never shared their experiences about their hospital birth with a nurse midwife because of me leaving that open. And maybe that might have brought a lot of healing, let them validated their feelings. Like a lot of people didn't know, like, is this wrong? Like literally that's what I was getting was people coming saying, this was my experience, not knowing anything about my experience, not knowing that I'm a lost mom, not knowing that anything about me. Just from this video, I had people sharing their hospital experiences and asking, is this normal? Is this normal care? Is this what normally happens during pregnancy or labor or whatever? And it was nice to have these conversations with these women because they had no freaking idea. They had no clue. A lot of them are first-time moms or they were first-time moms. And, and it's nice for them to share their experiences, one, because I think that's very important. We should be sharing our experiences with each other. It's how we learn, it's how we grow. And then also to be able to like ask, is this okay? Is this normal? Whatever. And if they're planning another baby, maybe they'll know for the next time, oh, that's not normal. I'm not going to do that again. And I think that's very important. So I think this should be an ongoing conversation, and we should continue talking about this and letting other people share their experiences and talking about stuff too. And, and this is for all sides. This is the providers too, can come up and say what they want to say, and let the consumer, really the people that are going to hire a midwife or hire somebody to, for the birth of their child, like everybody should be sharing on this.